My name's Erin Goss, and I'm a nurse practitioner at Baptist Health. Started my nursing education at West Ark in Fort Smith, and after that I worked for several years, and then I decided to go back and get my bachelor's degree, and that led me to get my master's degree as a nurse practitioner. So I went back to University of Arkansas at Fort Smith for my bachelor's, and I graduated with a master's of nursing science at Walden University. As a nurse, most of my career has been in Fort Smith, Fayetteville. I worked in Little Rock. We moved and come back, but now we're home. And so over the span of about 25 years, give or take, I've been doing this. But the majority of it has been in the River Valley, that I felt like I could do more, I could give more. So my patient population is adults and geriatrics. So that means that I take care of their chronic health conditions from any time that they could develop one until the end of life. I think that finding success with my patients, especially in different populations like the weight management, or if we're trying to get somewhere as far as cholesterol numbers are concerned, we're just trying to better ourselves. So I think a good day for me and what I do is actually helping people see improvements, that their work has paid off, become more healthy. I don't really care for, oh, here's a script, here's a script, here's a script. I like for them to feel fulfilled with their visits and fulfilled with their care plan without having to do a whole lot of, you have to take this, you have to take that. I like to take care of patients who need hormone replacement therapy. As I mentioned, the overweight and obese patients, I like to take care of them. I like to do men's health, and of course I like to do things like getting handles on blood pressure, getting handles on your cholesterol numbers, things like that, that again is going to help promote wellness throughout the lifespan. What I have heard, and I do believe, that I really care about the patients, I care about what happens to them, and I care about the decisions that they make. I think a lot of them have complained about so many things to other providers, be it doctors, nurse practitioners, or therapists, anything like that, but they kind of feel like they're not being heard. So I always like to start with a clean slate, act like this is the first time the patient's ever telling me about anything or telling anybody about it, and then trying to find out why. Why is this happening? What can we do to help alleviate a lot of the symptoms? But I think that the patients should know that when they come to me and put their trust in me, that I'm going to do everything that I can to help them.